I'm Katherine Radwancky, and I am the director of the Foundations Learning Program at Grand River Academy. I have been teaching for over 13 years. I started with a program that addresses adult basic skills and literacy skills in the county, and I worked specifically with a group of 16 to 21-year-old out-of-school at-risk youth, preparing them for their high school equivalency diploma, as well as teaching life skills. I started at Grand River Academy in 2005 as an instructor in the Learning Center. I've always been in search of better ways to help students who struggle with learning difficulties. So a few years ago I was introduced to brain integration therapy by a friend of mine who had been living in Colorado Springs area. Her son struggled with learning difficulties, and she was told about brain integration therapy. She took him to a therapist and saw a remarkable change in his abilities, especially his executive functioning skills. And so she was so impressed with it that she became a therapist herself. Robin taught me a lot about the brain integration therapy, and I actually went through the sessions with her as well to learn more about it. Then a few years ago I also went to a professional development seminar on sensory integration. And so I was seeing the connection between the different types of modalities that use movement and improve learning results with the movements. So I did more personal research on it online as well, and became very interested in trying to apply that to our students here at Grand River Academy. I brought my suggestion to the headmaster, who was more than happy to allow me to implement the curriculum this year at Grand River Academy. The concept of educational kinesiology actually started in the 1960s with some medical doctors who were working to improve brain functioning of patients who had suffered from strokes and other brain injuries. Dr. Paul Dennison in the 1970s took this further, took their research further, and applied it to education. And he coined the phrase educational kinesiology. I was reading and researching about all of the connections to movement and learning, and because of that I became very interested in applying it at Grand River Academy. The specific modules that I'm focusing on are both brain integration exercises along with sensory integration exercises. They're very similar, and both are geared at helping our different sections of the brain work better together. You can think of it like the brain is divided into two hemispheres, a left and right hemisphere, and they are separated by a bundle of nerves called the corpus callosum. And in order for both sides of our brain to work effectively together, they need to have a strong connection between them. And you can think of it as a highway of trying to get from one place to the next. If you came across a bridge that was out, you would have a difficult time crossing to get to your destination. Similar to students who have struggles with learning, one theory is that perhaps these bridges are not as strong in crossing the hemispheres, and so we can work to strengthen them or to build them up if they are insufficient by doing some physical exercises that actually are helping to reconnect or build stronger connections between the different parts of the brain that need to function together in order for learning to occur.